Good day and welcome to today's Dr. Anyoha's podcast. Today I am going to be talking about short stature. Short stature, by that I mean kids who are not growing as they should. Kids whose height are not as they should. And kids who are worried about their height. In other words, kids who are short in their height. So today we're going to be talking about short stature. Sometimes a kid is worried because they are the shortest in height in their school. And of course their parents are worried. And sometimes it's the parent that is worried, not the child. But if you're the shortest in your class, other kids can tease you because you're the shortest and you're not growing as much as other kids. So short stature or short in height is a concern for kids and parents. And this podcast is inspired by a child or a youth I saw. I think he was about 12 years old, whose mother was worried because he is short. He is perhaps the shortest kid in his class. He said, "I'm the shortest kid in my class." Even though he's a smart kid, he's very smart and quick. He does a lot of activities and he's very quick, but he's still the shortest in the class. The parent wanted to bring him in to check it out. Why is he the shortest in the class? And like I said, this bothers parents. Sometimes it bothers the kids. Sometimes the kids don't even care. But it's something to talk about. And when confronted with a kid who is short in height, a couple of things to actually contemplate. There's a couple of things to actually contemplate or think about as a physician. The first thing, of course, is this child's parents short? If your parents are short, you probably would be short in stature, in height, because your height reflects your parental height. The predictive height of a boy is the average of his mom and his dad's height. In other words, if you add mom's height plus dad's height divided by 2, that is the average. Then you add 2.5 inches. That would be the predictive height of boys if you're going to predict somebody's height. Now, if you're dealing with the goal height is usually their mom's height plus their dad's height divided by 2, which gives you the average. Then you subtract the average by 2.5. That is the predictive height of a goal, of goals. But of course, there's nothing predictive about height and weight. It's usually a mixture of a whole bunch of things. But if you were to predict a boy's height and a girl's height, this is the way to do it. You average mom and dad's height, and then for a boy you add 2.5, and for a girl you subtract 2.5. That would give you a prediction or an estimate of how much of what is the expected height of a particular youth who is growing. But that is, by the way, just to show that our height has a lot to do with our parental height. If this is mathematics, this simple mathematics is just to say that our heights have everything to do with our parental heights. So if our parents are short, we're probably going to be short. If our parents are tall, we're probably going to be tall. And of course, a particular kid can also inherit the habitus, the height of their grandparents or their uncle, a distant uncle. They could be tall because their grandparents were tall, even though their parents are short. This is called familial influence on final height. Thinking about familial short stature, in other words, a kid is short because their families, they come from families who are short. So there's nothing to do with that. This is separate. This is very clear cut that if your parents are short, you're going to be short. Most likely going to be short. But you might also take the tall stature of your grandparents. But these are familial short stature. And there are another category of kids who are short because they're growing very slowly. In other words, they're late bloomers. They're going to be tall in the future, but right now, at the moment, they're growing very slowly. They're growing behind or they are lagging their peers. They're lagging their peers. These are kids who at a time in the future would just sprout, and maybe when you go on holidays they're short. By the time you return from summer holiday, these kids have grown 1 foot. So they're kids who are slow growers and they're lagging behind, and they are just waiting to sprout. So these are like kids like that. They might be the shortest in the class, but they're just hibernating. Their growth is hibernating, and suddenly they sprout, and they could eventually be the tallest in the class while they were the shortest in the class. So this is a different category of kids. Those kids, their parents are usually tall. Parents are tall, and they will tell you that if something happened to their dad or to their mother, that they were shortest in the class, and suddenly they are the tallest. So this is called constitutional growth delay. So categories of short stature we see are kids who are short because their parents are short. So that's one category. The other category is kids who are short because growth is lagging behind, and they would eventually catch up and even overtake those peers who were laughing at them and teasing them that they were short. So those are broad categories of how to explain to parents about their child's height and short stature. And of course, there are different other causes of short stature. Other causes of short stature involve genetic abnormalities, or called syndromes. Syndromes that affects the capacity of a child to grow. There's a whole bunch of syndromes. I don't want to go into details, but some syndromes like what we call Turner's syndromes or Russell-Silver syndromes or Noonan syndromes. These are some of the syndromes that affects growth capacity, height capacity. Usually the kids born with those syndromes are very small. And in addition to that syndrome, they also have some other physical or facial findings and abnormalities that the doctors would notice either soon after birth or when they're growing. So these are different categories of things that cause short stature, syndromes, when kids have syndromes, which is basically problems with their genetic composition. So those kids can have short stature, kids who are born with syndromes. Also kids who are born small for gestational age. In other words, a kid who is born at weight of 3 pounds or 2 pounds, or very small babies. Sometimes when a baby is born very small, called small for gestational age, when a baby is born very small, they tend to be very short. And the short stature of these babies who are born very small babies with low birth weight, like babies weighing 3 pounds, 2 pounds. The normal birth weight of babies are usually about 5 pounds to about 7 pounds. And, big babies can be up to 9 to 10 pounds, but some babies are born very small, and they're called small for gestational age, and they can weigh about 3 pounds, they can weigh about 2 pounds. And in this era of advancement in neonatology, babies who are born 2 pounds, 1 pound could survive and thrive. So sometimes these babies are very small and the height is very small, and they continue to be very small throughout life. And they don't catch up at age 2 as expected of small for gestational age. And they continue to be small and continue to grow very short. Those are categories of babies and teenagers and youths that are small because they were born small, and they continue to be small throughout their life span, and even at adult height, they're very small. Other things that can limit capacity to grow, and those include chronic illnesses and nutritional disorders. If a child is not eating and getting their calories, they don't have the caloric intake to grow. They don't have the caloric intake to grow, because you need calorie, you need food or substrate to grow. If you don't have access to food, your body will not be growing. So, of course, if you're chronically sick, if a child who is chronically sick, that's going to limit their capacity to eat. It's going to limit the nutrients it can get to grow. So chronic illnesses can decrease height and eventually lead to short stature in adult when you become an adult. Some kids have what we call anorexia nervosa. In other words, they're anorexic. They just don't want to eat, either because they're afraid of eating, or they're watching their weight. They're watching their weight and they want to be thin, or is it psychological problems related to food avoidance? So that could also limit calories and limit capacity to grow and eventual adult height. Those kids can be short as well. And of course, diseases of the bowel, diseases of the gut, like some inflammatory bowel diseases, can also lead to short stature. Example of inflammatory bowel diseases are things like ulcerative colitis is one of them, which the doctors would easily find out and tell the kid what they have. And Crohn's disease is another inflammatory bowel disease that can also limit growth in height, as well as other diseases like celiac diseases, and there's a whole bunch of gut diseases affecting the intestine that limits food absorption. When you eat food, the nutrients have to be absorbed into the body system to enable the bones to utilize it for growth. So if your body is not absorbing nutrients just because you're not eating, you would eventually have short stature. So diseases are involving the gut, diseases involving the renal system, the kidneys, would also cause growth limitation and eventually short stature. Kids taking medication for attention deficit hyperactive disorder, which is ADHD, could also have limitation in their height, in eventual adult height, because those stimulants that are used for ADHD might limit growth. Oral steroid for a long time for any condition, either a kid has arthritis, rheumatoid arthritis, which is an inflammation of the joints, or a kid who's on steroid for asthma, chronic asthma. Some of this could limit eventual height of that child. Steroids affect growth in children and should be used wisely and very cautiously. Also, there are other conditions that can cause short stature, decreasing height, and make a child become very shorter than peers. Things involving the brain, diseases involving the brain are part of it, especially tumors around the pituitary gland could be part of it. And of course, kids with thyroid problems, low functioning thyroid, could be also very short in their growth, final adult growth. There's a whole bunch of causes that are not known. There are a lot more causes that are not known. Times when there's no definite cause for a child's short stature. Usually, what the physicians do is to try to investigate. They try to investigate and see, especially if it bothers the child and the mom and the parents, physicians will try to investigate and find out if you can come to a reasonable conclusion as to why a child is falling short of their growth capacity, especially when the parents are very tall. So the physician would try as much as possible to try to find out why a child is not growing or why a child is the shortest in their class. It's always good to find out. How do you find out? To find out is, of course, to begin to ask questions as they find out about the family. Are the parents short? Is the mother short? Is the father short? What about grandparents? You find those, that's very important. And of course, you find if the parents had growth delay, were they lagging in their growth? Like I said, some kids might be short because their growth is lagging behind, and they will catch up in the future. So, family history of all these, asking questions to elicit some of this information is very important as to trying to solve the puzzle or to reassure the kid, if possible. Asking questions about diseases, common diseases that could cause decreased nutrients, decreased food intake, diarrhea, chronic diarrhea, and lack of absorption of calories and food and nutrients is very, very important. Things we mentioned before, like ulcerative colitis, Crohn's disease, celiac disease, and of course the use of medications for ADHD. Eliciting all this information will give the physician a very important knowledge, information about the particular condition of a child, peculiar situation involving a particular child. Every child is different. What might be causing short stature in one child might be different from what is causing short stature in another child. Eliciting this information would help the physician to arrive at a reasonable diagnosis why a child is short-statured, why a child is not growing as his peers. Examining the child to find out if the child is developing very well, looking for secondary sexual characteristics. Is there any axillary hair? Is there any pubic hairs? Is there a change of voice? Is the kid going through puberty? Some kids have delayed puberty, which means they haven't gotten to their maximum growth velocity. Some kids will have early puberty and they are tallest in their class, but other kids would be lagging behind in their puberty and their growth is waiting to sprout when they enter into puberty. So looking for signs of puberty, whether a kid has got into puberty or not, is very, very important as predicting if the kid has growth potentials. And this is important to reassure the parents and reassure the kids. And of course, looking for signs that the kid has hormonal problems like low functioning thyroid and other hormonal problems is very, very important. Like I mentioned, whatever medication a child is taking might be limiting their growth velocity, and the doctors have to inquire about that to be able to educate and to try to get to the bottom of why a child is not growing as rapidly as their peers. Sometimes after this investigation, the management is just to wait. Most times what physicians do is they look at the child's growth velocity, the child growth curve, getting the child's growth curve, the trajectory of their growth over the years, 3 years, 4 years, is very, very important because you want to see if this child is maintaining a channel, is maintaining their trajectory, or if they're falling behind, falling lower in their trajectory of growth. Growth over time, growth velocity, growth trajectory over time gives the doctor a very good insight as to what's going on with this child. A child who's consistently on their growth trajectory and channel or path is different from a child who has fallen below their path or their growth trajectory. Those are very, very critical information the physician would want to obtain before advising the parents, before sharing information with the parents as to what is causing the short stature and what he or she thinks would be the future of this child's growth velocity. So that's very, very important, growth pattern of this child. By and large, most times the physicians don't do anything, just look at what's going on, get more information. There are 3 options actually in managing children with short stature. Number 1 is to reassure them, which is what we do at most of the visits, reassure the child that they would grow. They might not have reached their puberty, the growth spurt that comes in puberty. So that's one management advice. Another advice is that unfortunately you're going to be short. You're not going to be the tallest in the class because your parents are not that tall. You are growing, but you're going to be on the short side of normal. In other words, everybody's not going to be 6 feet tall or 6'7" or 6'8" like Shaquille O'Neal or LeBron James or Michael Jordan. Everybody's not going to be that. You might be 5'3", 5'4", 5'6", but you're still smart. Sometimes it's as reassuring the kids that you're probably going to not be the tallest, but you might be average, you might be below average in height, but that's okay. So reassurance is good. Other times we might have to probe further to find out, to do more investigation, to send the child for lab tests, to look for things that suggest that they may not have enough growth hormone to spur their growth or to support their growth. Or we can look for hormonal problems like low functioning thyroid or some other hormonal issues that could be contributing to these problems. Sometimes it may warrant getting MRI, magnetic resonance imaging, MRI or imaging of the brain to look at the pituitary gland, the brain, and make sure there is no tumor around the pituitary gland, especially if the child has headaches, vomiting, and short stature. So sometimes you can escalate the search for why a child is very short. You might be looking for genetic abnormalities, like I said, things like Turner's syndrome. Look at the chromosome of the child. These are blood tests. So sometimes we do some blood tests to try to unravel the cause of short stature. Sometimes we can send the kids for bone age. Bone age is to look at the capacity of this child to further grow. In other words, look at is there any growth left in the cartilage of this child or this youth? Do they have any growth potential left? This sometimes to predict if this child has more growth in them or not. Send for bone age, X-ray of the ankle or wrist. So there's a few things that doctors could do to try to unravel causes of short stature, especially if they're suspecting that is outside the two common causes, which, like I said, are, number one, you're short because you dad or mom is short, or you're short because you're lagging behind and you're going to grow. If there are suspicions of things outside those two categories and the doctors want to find out more, they can send for blood studies, x-rays of the bone, and see what's going on. Now, how do you treat this? How do you help these kids? Sometimes the kid is very worried about their growth. They're very worried that psychologically affected, and they're really worried, and they're very anxious. You can send me to a psychologist to help address that anxiety, self-esteem problem. You can help them. Or sometimes you can send the kids to a hormone doctor, an endocrinologist, who could look into the hormonal aspect of the child's issues and see if there's any hormonal causes of this short stature. You can send them to endocrinologists. That's doctors who specialize in hormones. You can send them to a GI doctor, a gastrointestinal doctor, to look for things that can cause GI problem, gastrointestinal problem that can cause short stature, especially if there is suspicion, if there are things suggestive of inflammatory bowel diseases like blood in the stool, diarrhea, abdominal pain. The kids can be investigated for things like celiac disease, ulcerative colitis, and things like Crohn's disease. These are things that can be investigated and treated. And also, if you think the kid has renal problems or chronic renal disease or kidney disease that's causing this short stature, you can refer them to a nephrologist. So there's a whole bunch of specialists who could also help with unraveling and treating the kids who have short stature. It could be a multidisciplinary intervention, especially if there is a suspected cause, a suspected organic cause for this problem. But most times there's not. It's just that a kid is short because their parents are short, or a kid is short because they are lagging behind in their growth velocity and capacity. Another specialty or someone can refer the child to is a geneticist. A geneticist are people who deal with genes and genetic problems. They can unravel chromosomal problems. In some cases, there are treatments available when a child has short stature and amenable for treatment. The most common is a therapy with growth hormone, but it has to be under the supervision and recommendation of endocrinologists in conjunction with other specialties who are involved in treating a kid with a short stature problem. In conclusion, it's a very important topic. It doesn't happen all the time, but I think it's a very important topic concerning kids who are worried because they're not growing as much. It could be a kid's problem. It could be a parent's problem. It could be aunt's problem. Somebody else could notice that this kid is not growing. But earlier, parents seek medical advice, the better, because there could be many, many causes of short stature. There could be many reasons why a child height is below average or why a child's height is short, it's good to seek the advice of a pediatrician, of an expert, medical expert, to help you navigate through all these reasons and find out, narrow it down to probable causes and try to get to the bottom of why a child is short. Some of the causes could be remedied. There could be intervention. A child could get help. If they seek medical intervention very early, the child could get help. And that will help them at least get to normal adult height or near normal adult height. Thank you so much for listening. This is Dr. Anselm Anyoha. I've been a pediatrician for 25 years and counting. And I also have a PhD in infant mental health and childhood development. I think this is a very important topic and I want you to please share this with your friends and families. Thank you.